Imagine if you couldn't see. How would you use your phone? Watch your favorite TV show, see your kids grow up, walk down the street, or make your favorite meal. Now, of course, many people do all this without being able to see, and anyone who has lost their sight to illness or injury can tell you it's tough. It's really tough. When I was a kid, I got hit in my right eye with a stick on the playground, and after a transplant, I still can't see much out of that eye, but I'm very thankful for what I do have. Well, Orion is offering hope and independence with a breakthrough tech device that's restoring visual perception. This is incredible stuff, and joining me today is Jason Esterhuizen. Jason is the world's second person ever to receive the device. I'm going to talk to him about his experiences using Orion and how his life has changed. Also joining me is Dr. Nick Talbot. He's a senior director at Second Sight, the company that developed Orion. And gentlemen, thanks for being on the show. Jason, let's start with you. Now, as I understand it, this device is actually part of a study. And how did you find out about it?
So, Kim, about 5 years ago, we were watching a show back home in South Africa called Carte Blanche. Second Sight were showing a device they have called the Argus, which is geared to people with retinal problems. But in that segment, they spoke about the Orion and that they were working on it, and it would potentially be able to bypass your eyes and your optic nerves and go straight to your brain. And I just knew I had to be a part of it. So constant emailing and just talking to them. They eventually invited me to Los Angeles to come for a medical screening, and here I am.
That's pretty amazing. Now, I understand that this was a car accident that caused your blindness?
Yes, that's right. I was driving, a guy ran across the street, I swerved, lost control, and just the impact of me hitting the wheel and the window and going out the sunroof. I broke my eye sockets, my nose, my jaws, my skull. Yeah, lost my right eye. The left eye's optic nerve got torn off. So yeah, it was pretty serious.
So now the device is implanted in your brain. Did that require surgery?
Yes, so Kim, it was about a 4 or 5 hour surgery. What they do is they cut open the skin, then remove a small piece of your skull. They slide in the device in between your two brain lobes. It's actually inserted under the dura of the brain, this little the skin that covers the brain. So it lays on top of the visual cortex. Then they close it all up, close the skin up, and that's it. No wires sticking out, so it's amazing, yeah.
That's phenomenal. It really is. Now, what can you see?
At the moment, what I see is a bunch of white dots on a black background, similar to looking up at the stars at night. These little dots get activated when I see movement or bright lights, or there's a button on the device that I can press to invert the color so that when I'm in a bright place, I can see dark objects. So yeah, I can see movement. If someone was approaching me from the front, like maybe 2 or 3 dots would light up. And as they get closer, more and more dots would appear. So it's sort of a depth perception aspect to it, yeah.
Did you have any negative side effects?
The one thing happened to me, and I'm the only patient that this has happened to, is when we were doing very early testing to set the parameters of the device to see, how much voltage or how, all the stuff that you can pump into the brain, we did cross a little bit of a line, and I had a seizure, but it was at UCLA. I quickly got anti-seizure medication and no side effects, and that's the last time that it's happened. So yeah.
So I did a little bit of research about you. I understand that you're like a really big baseball player. How does that work?
So that only happened when we moved to America, because baseball isn't really a big thing back home in South Africa. So in February of this year, I found a blind baseball team in South Pasadena called the SGV Panthers. They're the only blind baseball team in Southern California, and I joined them, and eventually ended up going to the World Series.
Oh, gosh.
For baseball. So yeah, apparently I'm a talented baseball player.
It's all pretty exciting technology. And thank you so much, Jason, for joining us here on the Kim Komando Show. So, Dr. Talbot, thanks for joining us here on the show. We just heard from Jason. So how did you come up with this idea for this amazing device?
I think it stemmed originally from the understanding that there's this large section of the population of blind people that are completely blind, for which there aren't really many therapies. There aren't many ways for them to be assisted.
Now, the FDA says that you're breakthrough technology. What does that mean?
So the FDA has this great new program called the Breakthrough Technology Program. It's for devices that are serving an underserved population or a population for which there are no approved therapies yet. The FDA works very closely with us so we can get early feedback on our design and our testing to make sure the device meets all regulations and make sure it's safe and effective, so that when we do apply for FDA approval, it will get approved quickly.
How do you find the candidates?
It's very hard to find these patients. So what we have to do is resort to radio ads and word of mouth. And we go to conferences by blind organizations. So yeah, it's very challenging.
So is there a particular person that you're looking for?
Yes, so we're looking for people who had sight at one time, but lost their vision through basically anything other than some sort of brain damage. So the person needs to have an intact visual cortex. We're really wanting to help people who are completely blind.
Tell us a little bit more behind the background.
Absolutely. I have a prop, if I can show it to you.
Yeah, please do.
All right. Meet my friend. So the glasses have a camera in the bridge of the nose here, and then the signal goes from there down this cable to the processor over here, which has some controls on it for the user. The signal goes back up. This is a little different from what you've seen so far, because this is going to be the commercial product. It's an early prototype. And this is the transmitting antenna here. Now, I can show you what happens on the implant side, which is sort of my field. So we have my other friend over here. Say hello. The implant has its own antenna, which receives the signal. Not only does it receive the data, but it also receives power this way as well. So we don't need a battery in the implant. The signal is decoded here, and stimulation pulses are sent along this cable. So you might be able to see the electrodes.
Right, yes.
The electrode array is slipped gently between the two halves of the brain, and it lies against the visual cortex right there. Let me see if I can give you a better view. So, my brains.
Your brains fell out. How are you making all these connections possible?
The device is customized to every patient. When we present the patient with a stimulus on one of those electrodes, it might appear anywhere in their field of view, in about a 40-degree field of view. So we have to map every pixel, figure out where the patient sees each pixel. And then we use that map in the processor to translate what's captured by the camera into the right stimulation pulses on their implant.
What do you see next for Second Sight?
Well, yeah, it's really exciting. The future is really exciting. In the near future, what we're working on are things like infrared vision. So people will be able to see in the infrared wavelength, and it'll be something they can switch into, so that when they want to see exactly where people are in a room or find their hot cup of coffee, I think that's really going to provide a lot of utility. And then there are things like binocular vision. So instead of having one camera here, we could have two cameras, and that'll give depth cues, depth information to the processor, so that we can filter out things that are far away.
Well, it's amazing technology, and I definitely want you to keep us posted on all your developments, Dr. Talbot.
Sure.
Really great stuff. Hey, thank you both so much for joining me and for sharing one of the many ways that technology is having, look at that, such a positive impact on our lives. With imagination and innovation, there's really no limit to what we can accomplish.